Tonight I'm filling in for the Premier. He is out this evening celebrating the birthday of his son, Ed. So we wish Ed a happy birthday, and we look forward to seeing the Premier back with us on Wednesday at the next press conference. But today we will have the Minister of Health, who will give the update on COVID-19 and the work of her ministry. We will also have the Minister of National Security giving an update on the work of his ministry and the regulations that his ministry has been overseeing through this period. And we'll also have an update from Minister Zane De Silva, who is the Minister of Tourism and Transport, who will give us an update on the work to get our public transportation system back up and running again, and also helping with our economy as a result. Minister Wilson.
Thank you, Deputy. Good afternoon. Between Sunday and today, there were 469 test results received by the Ministry of Health, and one was positive for COVID-19. I am, however, deeply saddened to say that we lost another person to COVID-19 over the weekend. As it is the norm, details of this individual will not be made public by the ministry in respect of the family's right to privacy, especially at this difficult time. And again, our prayers remain with that family. Bermuda now has 119 total confirmed positive cases. Their status is as follows. There are 45 active cases, of which 37 persons are under active public health monitoring. And I am pleased to say and to share with you that some persons that were previously hospitalized have now been discharged. So we have only 8 persons that are hospitalized, and a total of 66 persons have now fully recovered. As an indicator, as I've indicated earlier, the total deceased is now at 8. The average age of all of our confirmed positive cases is 60, and the age range of all of our positive cases is from 18 years to 101 years. The age of persons hospitalized ranges between 68 and 89 years, and the average age of those persons hospitalized is at 77. On Saturday, we completed testing of all of our 21 Bermuda's care homes, although the results of one care home are still being processed as that was completed on Saturday. To date, we have the results of 333 care home residents and 436 staff members from a total of 20 different care facilities. All of the tested of those individuals, 44 have come back positive. I now want to share with you the results of the Bermuda Omnibus Pulse Survey, which was commissioned by the Department of Health on the topic of COVID-19. This survey consisted of telephone interviews with 400 Bermuda residents conducted between April 22nd and April 29th during the shelter-in-place terms. The survey asked questions on various topics, including COVID-19 news and information sources, self-quarantine and reducing stress, impact of the shelter-in-place on behavior, programs and services, and routine healthcare services. On the topic of self-quarantine, only a minor of residents interviewed were required to self-quarantine, for example, if they traveled abroad, and the vast majority, 81%, of those who did self-quarantine indicated that they had suitable space to do so. Virtually all residents were aware of ways to reduce feelings of stress and anxiety, with by far the most common stress relief being the tactic that was engaged was exercising, either walking or running. Meanwhile, 2 out of 10 residents mentioned spending time with or talking to family and friends as a method to relieving stress and anxiety. And this was far more likely to have been mentioned by our younger residents that were part of the poll. A variety of behaviors were evaluated to determine what, if any, impact the shelter-in-place order had on residents' behavior. Some expressed positive changes and others expressed negative changes. Of note, 3 out of 10 indicated that they now exercise more frequently than before the shelter-in-place order, while the same number indicated exercising less frequently, and this perhaps relates to the fact that we have gym closures. I was pleased to learn that a greater proportion now indicate that their eating habits have improved and that they are better, and that's 32% of those polled, as opposed to eating habits having worsened, and that represents 12% of 19, percent of those polled. Fewer than 2 in 10 residents, 17%, required routine healthcare services, and of those, just fewer than one half, or 45%, have indicated that the COVID-19 pandemic has negatively impacted their ability to access these services. And of the services they require routinely, but have been unable to access, their doctor's office or clinic represented 36%, dentist 26%, and those were the two commonly mentioned areas of the survey. The topic of access to healthcare during COVID-19 actually segues perfectly into what I wish to share with you next. I'm thrilled to announce that today the creation of a new telenurse hotline and GP telehealth consultation services for uninsured and HIP clients. I want to first thank Argus Insurance for initiating this program and making this possible. Argus approached the government in late March with a proposal to provide telehealth, either through a nurse or physician services, to those persons in our community that are underinsured, and this was at no cost to the government. Initially, the program will work like this. When an individual calls the COVID-19 hotline, 444-2498, because they are feeling unwell with symptoms that are unrelated to COVID-19 and they are uninsured or have the government's HIP health insurance policy, then they will be transferred to Argus's contracted telenurse vendor, which is called PhoneMed. The telenurse will provide advice, and if the individual needs a consult with a GP, the calls will then be transferred to Argus to set up a telehealth consultation with a GP in Bermuda. Telenurse advice will improve access to healthcare and minimize unnecessary utilization of hospital emergency rooms and other medical services. And it is certainly a wonderful way to give back to the residents of Bermuda, particularly the vulnerable populations. It should be noted that this is a pilot and a feasibility study. The pilot will allow the Ministry of Health to better understand the extent of need amongst those in our community who are, for example, out of work because of COVID-19. However, it does not replace health insurance or the need to go to have a GP. I can also share that the Argus Insurance has implemented a number of financial relief initiatives that will help cash-constrained individuals and groups maintain their benefits while deferring premiums. Argus is offering its clients options to defer this year's premium updates while maintaining benefits to ease hardship on individuals and businesses where necessary. So in closing, I would certainly like to thank companies such as Argus, who are doing what they can to ease the financial burden on those who need it most during this pandemic. Thank you, Deputy.
Thank you. Thank you, Minister of Health. I would like to now extend our condolences to the unfortunate most recent death related to COVID-19 to the family and friends of that person. I would also like to continually, as we have expressed condolences to everyone who has lost a loved one as a result of COVID-19. And certainly we should keep in our thoughts all those who continue to fight this disease here in Bermuda and wish them recovery. The House of Assembly passed legislation on Friday, the 8th of May, amending the National Pension Scheme Occupational Pensions Act 1998 to permit a person under the age of 65 who participates in a private defined contribution pension plan or a local retirement product to voluntarily withdraw up to $12,000. The Senate will meet this Wednesday to debate the legislation, and if approved by the Senate, that legislation will then be assigned and signed by the governor. Following this, the Minister of Finance will then bring the legislation into operation with the publishing of a notice in the official gazette. Once the legislation has been brought into operation, a member or former member of a pension plan or local retirement product under the age of 65 will be able to apply to their administration for a refund of up to $12,000. This will require them to complete an application along with providing the appropriate supporting documentation. If the application is approved, their plan administrator will have up to 20 working days to make the payment to the applicant as requested. The Pension Commission will be providing specific guidance to the plan administrators to make the entire process as efficient and as timely as possible. Also during Friday's virtual session, the Premier confirmed changes to the Emergency Powers COVID-19 Continuing Precautions Amendments Regulations 2020. And these were as follows. Marriages and domestic partnerships can now take place with no more than 10 people, including the officiant in attendance. Clarity was given around scuba diving. It is prohibited during phase 1. And money service businesses are permitted to operate with the permission from the Minister of National Security, but restricting the number of persons inside at any given time in the business. It should be noted that licenses for money service businesses must receive the permission of the Minister of National Security prior to their opening their business. Now, the Minister of National Security will give his update as to the work of his ministry during this period of time. Minister Kane.
Thank you, Deputy. Good evening, Bermuda. For the most part, we are seeing broad cooperation in the community with compliance to the Phase 1 regulations. We are, however, monitoring community chatter about the possibility of planned events to commemorate Bermuda Day. Again, I urge the public to be mindful of the guidelines that are set in place. Any disruptions or breaches of the regulations could result in the Phase 1 period being extended. Sadly, as you are aware, last week our community was once again shaken by gun violence and antisocial behavior. Against the backdrop of what our country is facing, this type of activity is absolutely the last thing that we need. The Commissioner of Police has advised that the Bermuda Police Service have increased their patrols in key locations and are closely monitoring gang tensions. I encourage anyone with information with reference to last week's incident to contact the Bermuda Police Service at 295-0011 to share what you know. The Royal Bermuda Regiment continue their community engagement to ensure that the Phase 1 regulations are followed. This includes monitoring activity during the curfew hours, visiting the beaches, park, public spaces to ensure that persons are physically distancing and taking the right health and safety precaution. As a special note about curfew hours, specifically for boats and vessels on our water. As a reminder, under the regulation, the curfews for boating vessels is actually 7 p.m. and not 10 p.m. So to be clear, 7 p.m. for any boat or vessel or pleasure craft, they should not be cruising around the waters after 7. Individuals on the boats, after you get off the boat and tuck it away at 7, everyone must be inside their home for curfew for 10 p.m. Switching to the Bermuda Fire and Rescue Service. Last week, the Bermuda Fire and Rescue Service answered a total of 138 emergency calls. 93 were EMS related, 45 were fire related. Also last week, the Bermuda Fire and Rescue Service introduced remote video inspections, or RVIs, particularly for buildings and construction sites. With the COVID-19 pandemic preventing in-person inspections, these video links enable the fire inspectors to conduct smaller routine inspections, consultations, systems tests, and fire certificate occupancy inspections, keeping the health and safety and social distancing guidelines. Since its launch, 3 requests have been received for video remote inspection service. These methods, the video inspections are conducted via WhatsApp, Zoom, or FaceTime. Any business or construction site can utilize this service by emailing fireprotection@gov.bm. I would also like to take this opportunity to thank the Bermuda Red Cross for their recent donation of surgical masks to the Bermuda Fire and Rescue Service. Turning over to immigration, a waiver of certain fees. Fees will be waived for applications that would have had a resulting negative impact during the period March 18th to June 5th, 2020, for advertisement extensions, late applications, and appeals for the continuance of work. Expired passports and visas already resident applicants. For resident work permit holders and dependents whose passports and/or visas has expired, but who cannot obtain a new passport or visa, we will waive that requirement. Employers must ensure that the new passports and visas are applied for by August 4th, 2020. Applications should not be submitted for potential work permit holders and the dependents who are currently off island or whose passport and/or visa has expired, who do not have a visa, who do not have a passport and/or visa, and 3, for visa-controlled nationals whose passport and visa does not meet our 45-day rule. Lastly, regarding the Delta charter flight, which is due to arrive in Bermuda on May 15th, this special flight is the courtesy of Travel Edge and thus far has approximately 86 passengers scheduled to fly to Bermuda. The people on the flight include Bermudian students and residents who have been unable to return home since the pandemic. This flight also consists of some residents who have been abroad for medical treatment and who also are unable to get home. With the previous air bridge flights, all of the standard health and safety protocols will be followed at the airport to ensure the safety of our customs officers, our immigration officers, as well as the members of the flight. Everyone must quarantine at the government quarantine facility for 14 days. The fee for returning residents staying at the quarantine facility is $100 a day. Please note that the ministry is accepting applications for persons who are not able to pay due to financial hardship. This will be considered on a case-by-case basis. Anyone who may need to self-quarantine at home for medical reasons should apply to the Minister of Health. Both of these exemption forms can be found on the government website at forms.gov.bm/COVID-19 traveler quarantine exemptions applications. Once the flight has landed and the disembarking passengers have been processed, the same flight will return to the U.S. that same day with thus far 92 outbound passengers of varying nationalities. Thank you, Deputy Leader.
Thank you, Minister Keynes. And I wish to also acknowledge the presence of the Police Commissioner, Mr. Corbishley, here as well. And thank you for being here as well to this press conference. As part of our phased and measured approach to reopening the island, public transportation plays a crucial role with getting our people moving, but also getting our economy moving. The Minister for Tourism and Transport, the Honorable Zane De Silva, is here to give an update on the work that he and his ministry are doing to get public transportation and public transportation overall going, and as a result, getting our economy moving. Minister De Silva.
Thank you, Deputy Premier. Good afternoon. A week after the government's announcement of a phased reopening of Bermuda's economy, this is now an opportune time to update the country with an overview of the measures being implemented by the Ministry of Tourism and Transport to restore public transportation and reintroduce scheduled commercial flights to the island. The public will be aware that the public ferry resumed service today under a reduced operating schedule with limited passenger capacity. The schedule is available to download from the Department of Marine and Ports website at www.marops.bm. The Department of Public Transportation, or DPT, continue to operate the KEMH bus service while preparing to implement additional measures for resuming the public bus service. The DPT is working to reintroduce the public bus service in the following phases. Phase 1, Sunday public bus service operating 7 days per week. Phase 2, a full summer schedule. Before service can resume, There are critical items that are being resolved, and these include the following: installation of driver protection screens, deep cleaning of buses, obtaining agreement from the BIU and BPSU for the proposed scheduling arrangements, and from the Office of Safety and Health Committee for the proposed recommendations, installation of hand sanitizers on all buses, and managing crowd control and queuing at the central terminals. We expect these issues to be resolved in the very near future, and the public will be informed when the bus service is scheduled to resume. In the interim, all members of the public are welcome and encouraged to use the public ferry service. Now, on the topic of reintroducing flights to Bermuda. As an island isolated in the Atlantic Ocean, air service is Bermuda's lifeline to the rest of the world, and it is critical to many areas of our economy and ultimately has a major impact on our economic well-being. Air service to Bermuda is always a matter that has to be managed with the utmost consideration, but this is of overriding importance at this present time when considering the potentially menacing role that international travel can play in the spread of COVID-19 virus. In the face of the COVID-19 pandemic, the Ministry of Tourism and Transport is taking the lead role in reviewing and coordinating policy and the implementation of necessary controls in respect of air travel and its potential impact on the island. Last year, the Ministry of Tourism and Transport supported a collaborative effort between the Bermuda Tourism Authority and the Bermuda Airport Authority to produce a strategy aiming at improving airlift to the island. Together, these bodies commissioned an experienced aviation consultant called Aviation Pacific, or APAC as they are more commonly known. In the first quarter of this year, APAC were due to introduce its recently completed strategy to increase and improve airlift to the island. This strategy sought to grow Bermuda's airlift capacity, that is, to increase the number of airline seats available for purchase both to and from Bermuda. Increasing airlift capacity is an important stepping stone towards growing Bermuda's tourist economy. Of course, the COVID-19 pandemic has forced everyone to hit pause on the implementation of the APAC airlift strategy. But this does not mean that the process of building the strategy has not greatly assisted in other ways over the past 8 weeks. Being able to leverage APAC's broad range of relationships within the industry and being cognizant of the recently completed strategy document, as well as partnerships with the Bermuda Tourism Authority, the Bermuda Airport Authority, the Skyport of Bermuda, has been in constant contact with its airline partners. I am pleased today to inform the public that all the airlines serving our country before COVID-19 say they are ready to return to Bermuda once the crisis passes. However, and perhaps not unexpectedly, the mix of gateway cities, the time of year, and the frequency of flights may not be what we have become used to in years past, at least not initially. We should anticipate a gradual resumption of air services. We should certainly not expect to return to normal immediately. In updating the public on the current situation in regard to air travel, I would add important words of caution that by its very nature, this is a constantly changing situation that may improve or may indeed worsen by the time we reach phase 4 of reopening, the new normal phase. When the time is right for regular scheduled commercial flights to resume at LF-Wade International Airport and non-residents are once again permitted to pass through our borders, we anticipate service to and from the following airports to recommence. And they are New York's John F. Kennedy International Airport, Boston's Logan International Airport, Atlanta's Hartsfield International Airport, Toronto's Pearsons International Airport, and London's Heathrow Airport. The British Airways service from London's Heathrow Airport will be a new service for Bermuda and will replace the previous British Airways service from Gatwick, after British Airways consolidated its operations at Heathrow, at least on a temporary basis. For our tourism sector and the majority of residents traveling from Bermuda, the change from London Gatwick to London Heathrow could have many advantages, particularly given how much easier it is for travelers to connect to other European countries from Heathrow as opposed to Gatwick, which has limited European connections. In the meantime, we anticipate the resumption of airline service to Bermuda from Philadelphia International Airport and Miami International Airport sometime in the not too distant future. However, we would stress that we do not anticipate services from any of these cities resuming immediately upon Bermuda reaching the new normal phase. Like everything else at present, this is also subject to change. Lastly, I would like to advise all of Bermuda that the seasonal services from Newark International Airport, Washington Reagan Airport, and Charlotte Douglas International Airport are unlikely to resume in 2021. It should be stated that throughout discussions with airline partners, the ministry has been extremely pleased with the responsiveness and the flexibility shown, particularly considering how much turmoil currently exists throughout the global aviation industry. At this point, I would remind the public of another extremely important reality. Dialogue with airlines and winning their commitment to serve Bermuda is really only one half of the owner's tasks associated with restoring post-COVID-19 airlift to Bermuda. I can also reassure the people of Bermuda that the Ministry of Tourism Transport is working very closely with the Ministry of Health to prioritize a long list of public health requirements that must be implemented to keep our community safe at this time of the new normal as it approaches. There still remains much work to be done in a multitude of areas as we progress towards phase 4 and the new normal. Our primary focus is to ensure that as an island, we get to this point safely and responsibly. Thank you.
Thank you, Minister De Silva. And finally, I'd like to extend a word of thanks to all of my colleagues that are here today, but also to the ministries and departments behind them that ensure that the work that they're doing is done well, and they're all doing a great job. I would also like to extend a heartfelt thanks to my own ministry team, those at the Ministry of Home Affairs and all the departments. And I'd like to particularly give a thanks, because I haven't had an opportunity to do this during this period, is to my PS of Home Affairs, to particularly the Department of Environment and Natural Resources, which has been giving great assistance to our commercial farmers, commercial fishermen, to the veterinary practices, and also to pet stores. And I would also like to give a thanks to one particular department in my ministry, the Department of Consumer Affairs, which is fielding a lot of questions from people around issues around like consumer protection through this period. But as I said, there are many ministries and departments, including this one of telecommunications, or like I should say communications, that has been doing a great job through this period. So I extend this thanks to that team as well, who's been here every press conference, helping to make sure that we get the message out to the public. And I also like to thank everyone in the island who has been working to protect our community from COVID-19. And particularly those who have been helping us to enforce the emergency regulations, which have been in place for a number of weeks now, and who are sacrificing a lot of their time and energy right now to get our economy back going in this phase 1. But I'd like to also mention as well, the goal is to get to the next phase. It's not just to stay where we are. And that will depend on a number of things. That will depend on the number of new cases that we get. It will depend on the number of hospital admissions. It will depend on the number of ICU admissions. It will depend on compliance by the public regarding physical distancing. Obviously, people in public, we've asked them to wear masks. And Also, the amount of hospital PPE that we have that will ensure the protection of everybody who's working to take care of people through this period. And health and the use of the Health IQ app as well will help our community to manage the situation. This will all be obviously led by the Ministry of Health and how we get to that next phase and the advice that the public health professionals provide us in the government, and that will guide those decisions that we make. And of course, at the end of the day, if we all follow the rules, we will get to the next phase. So it's very important that we remember it's by our cooperation and following the rules that are carefully laid out that Bermuda will get from one phase to the next. And we will be a healthier country as a result, and safer country as a result. And with that, I conclude and would happily receive any questions from you who are here today.
Good evening, Deputy Premier. Glad to have you here tonight.
Good evening.
You were talking about moving from phase 1 to phase 2, and maybe any of the people up there could answer this, that how would you compare the first weekend of phase 1 to the second weekend of phase 1 of behavior and making progress towards going to phase 2?
I would refer that answer to my colleague, the Minister of Health or the Minister of National Security.
With reference to what was seen on the road and in the community, we have the Commissioner of Police here, and I'll ask him before we go to what we see going to the next phase. I'll just have him talk briefly about what was seen in the community this weekend.
Yeah, I mean, probably the key difference is people just getting used to the changes in the regulations. Before, we were seeing quite a number of nighttime curfew breaches and we were seeing arrests. Thankfully, that's gone down. In regards to the daytime, we had some challenges on the water. Indeed, we had 3 parties arrested over the weekend that came from separate households, but in the majority, we've actually seen really good support from our marine community. We're out and about every day. We've moved from the community advisory points to fixed points and actually are in public spaces. And the position that we take alongside our colleagues in the regiment is around advice and guidance. We don't want to criminalise people. We want to work with them, but we will take enforcement action where necessary. But I think as people have become more familiar with the regulations, because the style of policing is around community-based and working with, not against, we're actually seeing, as echoed by the Minister, a high level of compliance. But there are the odd occasion where we've had to deal with some misdemeanors.
Okay. One of the best ways to combat this disease is for everyone to wear masks. The Ministry of Health's guidance on the use of masks has sometimes been confusing and ever-changing over the course of this crisis. Government guidance seems to recommend that people wear masks in public. However, we are witnessing a high percentage of taxi drivers, delivery drivers, motorbike riders, people walking around town, people walking in the parks, etc., many of whom are not wearing masks in public. It was stated last week that people should wear a mask whenever they're out in public. What enforcement efforts are in place to ensure compliance?
Just when you're dealing with enforcement, the shops and taxi drivers and lorry drivers, they have to wear masks. Section 13 of the Act is very clear on what is required, and they can go and there are specific things with reference to PPE, distancing, and keeping the businesses, making sure that the hands are sanitized. The Act in Section 13 of the regulations are very clear. The enforcement part of that is in Section 18 of the Act. The enforcement empowers the Bermuda Police Service and it empowers the Bermuda Regiment. And they will go in and they will look and take a note. When they give that note and they see something going wrong in that establishment, my understanding is that that information is given to the Minister of Health, and the Minister of Health is authorized in law, if she deems it necessary, to shut that business down because they are not complying with the law. We have the necessary backing of the law. So if we see a taxi driver and he's acting as a delivery vehicle and he's not wearing the mask, that is a breach. And there is a mechanism in law for that to be dealt with. And so if you go into a business and a business is not, they're not practicing social distancing, or they do not have a hand sanitizing regime, or people in that establishment, they do not have their mask on, the Bermuda Police Service and the Bermuda Regiment will be going into these businesses as the enforcement officers under Section 18 of the Act. The beauty of this is we had the opportunity to debate this on Friday in the House and share what we believe the reasons and the mechanism for it. It's not to be heavily handed to have police officers in the building. They are indeed the enforcement arm of this. So we are mindful, as the Commissioner said, we don't want to become a police state, but we believe that the health guidelines given to businesses are very clear. And the enforcement officers under the legislation are the Bermuda Regiment and the Bermuda Police Service, and they indeed will be going into these businesses and looking at taxi drivers, or if there's a truck driver that is delivering and he is not wearing his face mask, there are mechanisms in the law for them to be held accountable, and we will not hesitate to use those necessary mechanisms.
All right, thank you.
Because you made the comment that the guidance seems to be changing, and that's actually correct. Bermuda as a country, we're not making this up as we go. We are relying on international best practice, such as through PAHU, World Health Organization, CARFA, as well as Public Health England. And the circumstances are changing, as you can appreciate. A few weeks ago, we were speaking about the fact that the only persons that were required to wear face masks were those persons that were either ill or alternatively caring for persons that were ill. We've now moved forward because of the advice internationally would suggest that everyone that's in a public space should be wearing a face mask. You would have noted that we changed the guidance as it related to social distancing. A few weeks ago, it was 3 feet. Now it's 6 feet. So as the guidance changes with respect to international best practice, then Bermuda will also adopt our changes accordingly.
Thank you. On May 1st, Health Minister, the government stopped providing certain information on the COVID-19 updates, including results pending, data on outstanding test results. Almost immediately following this withdrawal of information, we've seen substantial delays, with some people waiting up to a week to learn their test results. Bermuda has been promised 24 to 48 hours for real-time PCR testing. Why is it taking so long to return timely test results?
That's a very good question, Don. You would have recalled probably, I guess, about 3 or 4 weeks ago, we were on average probably about 30 tests a day, depending on how many referrals were made from directly from the physicians. With the opening of Southside, we have obviously advanced our capabilities. There were over 400 tests that were done, completed this weekend. So we do recognize that there's a lot more tests, and the volume has increased drastically over the last couple of weeks. And we are working on an electronic mechanism so that when a person books their test, their results will be provided to the person that's booking it electronically, as well as their physician. So that process is undergoing as we speak.
All right, thank you. Minutes as a follow-up, it is important to get the results of the PCR test returned quickly, so that the persons who are without symptoms can isolate quickly if they're carrying the disease. Is it not important?
Absolutely, absolutely correct. And all positive cases, that information is provided to the epidemiology and surveillance team as soon as they're known, so that public health action can be commenced immediately.
Thank you. The Ministry of Health has repeatedly attacked some members of the media, saying that it asks intrusive questions, yet the ministry has been less than forthright about its own efforts to protect the residents of rest homes. Is it true that the virus has now been confirmed in 5 different rest homes, and that the virus has killed 3 persons from the rest homes? If so, how is it that the virus has been allowed to invade a further 3 rest homes and result in 43% of the total mortality figures from COVID-19?
So those 8 questions, I'm not sure if I'm going to get them in order, but first of all, I think it's incorrect to say that I attacked the members of the media with respect to comments that I've made previously. I think it's important for you as professionals to ensure that we are professionally reporting information, as well as not requesting information that could lead to the identity of individuals. So to say that I attacked it is a misrepresentation. I'm just simply imploring you as professionals, members of the media, to not ask questions that are probing to such an extent that would serve to identify the individuals that we're speaking about. However, as it relates to I'm not sure what was 5, 6, 7, and 8 question. I'm sorry. I got that was the first 3, but
Well, I
You can
think
repeat the last four
with the
questions.
recent death today, I think the actual figure
Oh, yes,
of
about
the
the rest
deaths
homes.
is,
Yes.
is down from 43% to 37.5%
Right.
now.
Well, as we've spoken about before, unfortunately, because we have an aging demographic as well as a high incidence of chronic diseases, we recognize that the most vulnerable persons in our community that will likely succumb to COVID-19 are those persons in that demographic. It is incorrect to suggest that we've not been forthwith with respect to the information concerning the rest homes. When I gave a press statement on the 8th, I did indicate that there had been 3 other cases with respect to positive cases involving the rest homes. There are 5 in total, as you would note. And at the time of giving that particular statement, you would recall it might have been Wednesday. I can't remember what day it was. These days seem to blur. That at the time, the information, the family hadn't been advised. So again, out of sensitivity to the family, I was imploring the press to not necessarily probe that issue because the family members hadn't. And I'm sure we would all appreciate that. We would rather our family members receive that information, or the patient in particular themselves, as opposed to hearing it on the 5:45 newscast.
Thank you. My last question. The cost of living in Bermuda continues to rise while a large percentage of Bermudians are out of work and are struggling financially due to the lockdown and crisis. Will the government consider a temporary lifting of import duties on food and other essential products to help lower costs during the crisis?
Thank you for that question. Perhaps it's important that BBC go back and research this matter with some detail, because it was a couple of budgets ago where we actually made changes to customs duty on a number of essential items, in particularly fresh fruits and vegetables. As you remember, there was another matter of which we were looking to address as a public health matter. And one of the responses we did was we made it zero duty on eggs, potatoes, cauliflower, broccoli, carrots, turnips, oranges, and apples. So fresh fruits and vegetables were given zero duty, and that remains to this point. So we certainly hope that people are taking advantage of that. And those are, as you know, essential items. We will consider looking at other things, but those are the fruits and vegetables that actually have zero duty. But there's one way to avoid customs duty, Mr. Burgess, is for people to buy local produce from our local farmers, which is in quite large abundance right now. So there's plenty of local products out there for people to buy, and you avoid the perils of customs duty by supporting our local farmers.
Good evening, everyone. Maya Palacio here from Media Maya. The question I have first is for the Commissioner. Can you please give the island a statement or update on Cheval Dylan Burgess?
Yeah, we did a press conference today, and we continue to work closely with Cheval's family. We are extremely concerned to her well-being, her current whereabouts. It's her birthday tomorrow. One can only imagine how her family feel at this difficult time. We appeal for any information, anything at all from the public to be presented to the BPS or Crime Stoppers. We hope that we are going to find her well, but given the length of time that she's been missing, obviously we're extremely concerned that either she's been held against her will or something else has happened to her. But we continue to search, and I'm extremely grateful to the local community that have come out in abundance to support us alongside the regiment. And we've covered probably around about 90% of land areas in Bermuda, but we continue to search and we continue to appeal for information.
Thank you very much. My next question is again for you, Commissioner. Today you actually mentioned in your Twitter that there have been a number of burglaries on the island since. Can you give me a figure as to how many burglaries have occurred since May 2nd?
Yeah, I think what happens is, as obviously the regulations and as we move through different processes, unfortunately, crime is not that far behind. And the Minister mentioned we're doing a lot of work to ensure that there aren't any gang problems. We have seen, only in very small number, some burglaries. These have come about through insecurity. People have been able to enjoy some positive weather, and no doubt they want to get some fresh air. So my message today was to encourage them to secure their premises. We've also seen some credit card fraud, again, as new businesses have come back open. So we're asking our business colleagues just to be sure and check things. And we've spoken to the Chamber of Commerce in that regard as well.
Thank you. Is there a possible number that you could give me of how many burglars have occurred since May 2nd?
Off the top of my head, no, but I'm happy to come offline, but it's certainly only single figures.
Okay, thank you very much. My next question for Minister Keynes is, for persons who are coming home from the Atlanta flight and who can go into the government quarantine, and how people can apply if they have a health issue to stay home. If persons live alone at home by themselves, can they be exempt and can go home to quarantine?
I don't want to speak about the exemption process in isolation, so let's just walk through it, yes? A flight is coming back home. The main objective is that people are coming home that we're protecting our biosphere. So the purpose of putting people in a government quarantine facility is for us to look at 14 days. They're tested, they're in, to make sure that we're safe. People can quarantine at home if there is a medical issue. That person has to apply to the Minister of Health, and only the Minister of Health can allow someone to self-quarantine at home. They have to speak with the Minister of Health, and she will make the decision for them to indeed self-quarantine at home. There's another way. If a person they're abroad and they're a student or they can't afford it, they can write again for an exemption under financial hardship. And so the whole purpose of this is, in the main, to have people to quarantine at the government quarantine facility. If there is an exception, a rare exception where a person has a medical condition, the Minister of Health makes that decision, and then they can go from there.
Thank you very much.
Yes, ma'am.
And my final question is actually for you, Minister De Silva. I got a question from the public. I'm going to bring it up. And they're asking, this is a quote from them. Most people in the tourism industry have concluded that there won't be a season this year. What assistance, if any, would the government be able to offer to the taxi drivers, minibus drivers, and other services providers whose sole income is reliant on tourism? What is the government going to do, if anything, to help get them to April 2021?
That's a pretty good question. I think if I could answer that question, I could be in another business. But as you know, the government have introduced a benefit and have been paying a benefit to the tune of $7 to $10 million a week for the past several weeks, which may or may not include some taxi drivers and minibus drivers. What are we going to do going forward as far as tourism goes? We are working around the clock to try to figure out our way forward and how we get out of this virus and how we come out of it and what we do. It's so many moving parts, but we have a huge group of people that are working collaboratively to get to that point. With regard to assisting them, that's what we're doing right now. We don't know what the future holds with regard to our economy and how deeply it's going to be affected. You will know that the Minister of Finance is putting together an economic team that will assist in that regard. But when it comes to actual financial benefit to anyone in the country, the finance minister and his team, as well as us in cabinet, that's a constant. It's a constant for us. And we're very aware of the effects that this is having on whether it's taxi drivers, hotel employees, whether it's retailers, everyone is included in that sphere. And we're doing our very best to do what we can to try and help in every way we can.
Thank you. I do actually have just one more. It is addressed to Minister Fogo, but she isn't here. But the question, if anyone could possibly answer it, is how many persons have indicated to government that they no longer need the unemployment benefit because they're back working?
You're right. That will be a question that will be for you to have the specificity that you need. That should be properly directed to Minister Fogo. I will endeavor to get that number and get that to you.
Thank you very much.
Evening, Deputy. Evening,
Good evening.
Ministers. The first few of the questions here are actually just for the Health Minister relating to.
Can you speak up, please, Jonathan?
Can I- as it relates to the testing of hospital staff. Minister, good evening. We wanted to know if there was a reason that you hadn't seen fit to issue a directive for BHB to have all of their staff tested at this point.
Yes, that the hospital, I meet with the hospital regularly. In fact, every week we meet, including the chairman of the hospital board, and we discuss a number of things. I am satisfied that the protocols that the hospital has established with respect to their testing regime are satisfactory. It is certainly something that's discussed, and I am also satisfied that if the circumstances warrant a review of that particular protocol, that the hospital will do just that, and then they'll inform me accordingly.
Thanks, Minister. Also, since we have had requirements for all non-BHB rest homes to be tested in their entirety, should the same policy apply to the BHB long-term care units that have elderly populations?
That's a very good question, Jonathan. And again, the protocols that have been established by the hospital with respect to testing of their residents of their patients, as well as their staff, are circumstances that we discussed. You'll note that from the 1st of April, all persons that were admitted into hospital were tested for COVID-19. And there are considerations right now as to whether or not to extend that testing regime for the persons in the long-term care portion of the hospital.
Thank you. And just to be specific, are there any traces that we're looking at right now? Do we know, are there possibilities of community transmission on the island? Just to nail that one down.
Sure, thank you. That's a very good question. As I've mentioned previously, Bermuda has local transmission with cluster cases.
Yeah.
And the moment that if we do, if the status is elevated to community transmission, then that will form part of my report. I will immediately alert the public and members of the press if community transmission is established in Bermuda.
Thank you, Minister. Could I also ask what's being done to ensure and monitor the standards of palliative and medical care at the nursing homes with COVID cases, including Matilda Smith, Williams, and Westmeath? We know that some of their most senior medical staff have tested positive, that they're operating with low numbers of staff, and that they're also caring for COVID positive patients. Can you tell us a bit about how this is being managed to ensure everyone is getting the treatment and care they need?
Thank you, Jonathan. I have mentioned previously, because that's a very important question, and I've discussed this previously throughout the course of these press conferences, that the Ministry of Health continues working with and dialoguing with our rest home community. There are a few homes that are owned by government, but the vast majority of the 21 rest homes and care homes in Bermuda are owned privately. We continue to provide resources to them, such as education and training, how to properly apply PPE. In some cases, we've assisted by providing PPE for some of the homes that were having a shortage of those. We also continue to engage the rest homes, with respect to ensuring that they have education as it relates to infection control. And in some cases, we've actually provided them with nursing care where there has been a shortage of staff. So we are constantly engaged with the 21 rest homes to ensure that we can provide the best support needed at this particular time.
Thank you, Minister. Minister De Silva, it's good to see you.
Good to see you too, John.
We touched a bit on the commercial flights. Going to throw this out. Air travel, I mean, the routes, it used to be cutthroat, and the competition with jurisdictions to the south of us. Early days, obviously, but can you tell us in any ways how the pandemic might have changed the state of play on that in terms of competing with other destinations or trying to woo flights to us?
Well, as I said in my presentation earlier, we hired air development consultants last year, and we are well on our way. And I think you said it right. It's fierce competition for airlift to the country, and has been a challenge for some time for us. So how will it affect us going forward? I would suspect that our neighbors to the south are going to be just as hungry and as anxious as we are to get air service back to the country. So it's going to be a battle. It was a battle before. It's going to be a serious battle going forward.
Finally, again, obviously, it is early days. One thing we get a lot of questions on, the public are clamoring for whether there's a more robust plan on business, on salvaging jobs, getting people off social assistance. Minister Oban, you might be able to address this, but really just anything that might be in train at the moment in terms of support for businesses.
Thank you for the question. And I don't think we have any problem answering this question whenever it's raised because we know that it's high on the public's mind. The Minister of Finance is likely to be here on Wednesday, and some of the economic questions that need to be asked can be put to him at that point. As the Minister for Transport and Tourism said earlier, and the minister himself has said, I believe, on his Facebook chat and other conversations he's had with the public, he's putting together a economic team to give advice as a wider stakeholder effort to develop a solid plan on getting the economy back going, getting people back working, and some of the things that can be done to find a normal, whatever that normal will be. But certainly to do efforts that will get people off of benefit and people back working. I think, as you've seen through the phase one, part of that effort was to get some economic activity going that can put people back in a working position, and thus some of those people will migrate away from the unemployment benefit. But we know that there's a lot more work to be done. But I suspect that on Wednesday, with the appearance of the Minister of Finance, some of your precise questions on that can be answered further.
Right. Oh, thank you, sir. I did have one last question that had been sent in, if I could. Again,
Go ahead, Jonathan.
this is all up in the air. Folks wanted to know, we've heard about moving up the phases. If we all behave, if we do what we're supposed to as of right now, are we looking at the possibility of a full 2 weeks and then moving to the next phase, assuming that we all follow the rules?
Well, I mentioned that earlier, but I'm happy to reiterate it again, if that will be helpful for everyone. How do we get to phase two? And that will be by a number of key things that happen. One is it all depends on the number of new cases. It will also depend on the number of hospital admissions. It will also depend on the number of ICU admissions. It will also depend on the compliance of the public regarding the physical distancing, and also particularly in moving about through the community, and also with businesses with wearing of face masks. It will depend on what happens around the resources that we have in the area of hospital PPE, and also the use of the Health IQ app, which can also help, as the health minister has reported earlier, how the use of that app can help us to monitor what's happening with the community. And it will also depend on the advice that we get from the Ministry of Health and Department of Health and the professionals there as to what our state of situation is. And yes, we all must follow these rules. And that is what will help us to graduate from this phase to the next. But it's important that all these key things happen in the way that we have guided the public thus far. And I'd just like to say in conclusion that I'd like to thank the Bermuda public thus far for their patience through this process, through us getting here. I mean, we were able to graduate out of shelter in place to where we are now because of everything, a lot of the people of Bermuda doing what they had to do. And no one said that moving from one phase is going to be easy. It's not. But if we all do as has been instructed, and I again thank the Bermuda public for doing, by and large, the majority of our people doing what they have been asked up to this point, we will be able to move forward into the next phase, whatever that phase will look like. And with that, thank you everybody for coming. Thank you for the public for listening in, and we will see you back here on Wednesday.
This is a message from the government of Bermuda.
Bermuda, the emergency